I know because I've met with you before, we've talked, and I've looked into your stuff that robots don't do your surgery for you. So how do you explain robotics as a process to people that are interested in bariatric surgery for you?
Right. So robot is a misnomer, really, because you think about it. Especially this day and age, AI is a big thing.
Right.
Artificial intelligence, and everybody's talking about that, a hot topic. So when you say a robot, you imagine a device that can do something on its own. We all see the movies. You see a human-like structure that walks on its own and builds something without you having to actually, do anything. The surgical robot is nowhere near that. It's not that at all. So what I explained, the analogy that I always use, is a drone. Drones don't fly on their own, or at least not that I know of. And as a result, you need somebody that flies that on the ground. The only difference is that the pilot is actually not inside that device. So the same thing with the surgical robot. I have a console. I'm sitting there, literally a few feet away, and I control that robot, every move. So it's really just a device that I can control remotely. So what is the advantage of that? The advantage of that is really that it gives me three-dimensional visualization, as opposed to the conventional laparoscopy, which is going to be two-dimensional. It also gives you articulating instruments to mimic the surgeon's movements better than conventional laparoscopy. With conventional laparoscopy, you get only a straight stick where you can move it in a certain direction, but you can't articulate like you're doing open surgery. So this does, and that means I can do more precise surgery with it, and as a result, potentially have better outcomes for the patients, safer surgery, easier recovery, so on and so forth.